Hi, this is a case report about our patient is a 16 years old male. His chief complaint has an open bite despite he had ortho treatment which lasts for 3 years. Tooth number 10 is loose due to root resorption. He's interested in implant. His medical history. We took a CT scan and we can see in the panoramic over here that the tooth had resorption. Over here you can see that large periapical lesion which involved the buccal plate. We did an exam for the patient which reveals large periapical lesion about 9 mm in diameter, involves tooth number 10. Teeth number 9 and 11 responds to vitality test. No pain upon percussion. Soft tissue looks normal in shape and color. So what is the diagnosis? Our differential diagnosis primarily is periapical granuloma. Number 2, amyloblastoma. What is the recommended treatment? Number 1, tooth is resolved, the root is resolved, so extraction of the tooth as well as, because it is loose, excision of the lesion, clean up the area, bone graft to prepare the site for implant. We sent the biopsy to the lab. The lab results came with giant cell granuloma. Section revealed soft tissue and multiple fragments that show numerous multinucleated giant cells, all located in the central portion. The intervening stroma shows proliferation of fibroblastic and histiocytic cells and the presence of pigment-laden macrophages. What is giant cell granuloma? Giant cell granuloma, it is a non-neoplastic lesion of the gums or jaw bones, characterized by a proliferation of granulation tissue containing many multinucleated giant cells. What are the types? 2 types, central or peripheral. Central type is osteodestructive lesion of uncertain pathogenesis, which most commonly occurs in the young female mandible and is more lytic than peripheral giant cell granuloma. Imaging shows radiolucent destructive lesion which faint trabeculation and loculation. What is the differential diagnosis? Giant cell bone tumor, brown tumor. What is the management? Curettage. What about the peripheral giant cell granuloma? Peripheral giant cell granuloma, it's an overgrowth of tissue due to irritation or trauma. It is similar to biogenic granulomas. Color ranges from red to bluish purple, but is usually more blue in comparison to biogenic granulomas. It can be sessile or pedunculated, with the size usually being less than 2 cm. About 60% of the disease occurs in female, prevalence about 50 to 60 years of age, and happens and appears only on the gingiva or on an edentulous area. It is more often found in the mandible rather than the maxilla. It can be found in either anterior or posterior areas. Underlying alveolar bone can be destroyed, leaving a unique appearance referred to as cupping, resorption, or socialization. What is the histology? Peripheral giant cell granuloma appear microscopically as a large number of multinucleated giant cells, which have up to dozens of nuclei. Additionally, there are mesenchymal cells that are ovoid and spindle-shaped near the borders of the lesion, despite of hemosydrine and hemorrhages, is often found in 50% of cases. Ulcerations also present, and we can see all that in the picture. What's the treatment? It usually involves surgical removal of the lesion down to the bone. If there are any adjacent teeth, they are cleaned thoroughly to remove any possible source of irritation and infection. Recurrence is about 10%. Thank you.